With October being Breast Cancer Awareness Month, Afternoon Express felt it is critical during this time to highlight the importance of early detection, the signs to look out for, and how to manage treatment for these patients. I chat to Oma Mamatela, a breast cancer counselor at Breast Health Foundation, who is also a breast cancer survivor. Welcome to Afternoon Express, Oma.
Thank you so much. Thank you. I'm so grateful to be here.
Now, Oma, you know, as women, we all have many fears around getting breast cancer. But what are some of the common signs, symptoms, and what are the early signs we also should be looking out for?
The signs are the changes in the color of your breast. It's very important that you observe that. And again, the rash around your nipple, it's something that you should be aware as a woman, even as a man. And the other thing, our breasts are not the same size, but we make sure that the other one doesn't grow up normally. Then it means that there is a problem. And the other thing, on that nipple, blood will be oozing for some women. You need to make sure that you get it checked. It's very important.
Now, once breast cancer is detected, what treatments are available? And is it necessary to take supplements to aid breast health?
Once you've been diagnosed, it depends on how large the cancer is and how far it is. You can start with the surgery. They can remove just the lump. Sometimes you find women, they remove the whole breast. And the other treatment, it's called chemotherapy. Chemotherapy, the aim of it is to shrink that lump and stop it from growing. Remember, that lump grows. And the other treatment, it's radiation as well. So you find that you're going to do the three. For some women, they only do radiation. And for some women, they only do surgery and radiation. It solely depends on what kind of breast cancer you have. And in terms of treatment, where to get the treatment, Helen Joseph, it's a hospital where we accept anybody and everybody from all walks of South Africa, even Africa. You just walk in, we don't even ask for a referral. So it's easier to get the treatment there.
And as we continue in that conversation and in that vein, Oma, I mean, looking at the South African healthcare system, how affordable is this treatment?
To be honest with you, it is very affordable. When you don't work, when you come to Helen Joseph, the cost is only 75 rand. And we refer you to go chemotherapy, you pay 75 rand. And again, when we refer you to do radiation, you just pay for 75 rand. Radiation, you do it for 6 weeks every day for just 75 rand. So it's not about the cost. People should just get help. It's not about the cost.
Absolutely.
The cost is affordable at the moment, yes.
And it also seems like education is key, and that's why we're so grateful for you and everyone at your foundation who is spreading the news. Now, when it comes to self-examination then, Oma, how important is it for us to do regular self-examination? And if we find something abnormal or a lump, where can we go, especially now during a pandemic?
Okay, you need to do your self-breast examination on a monthly basis. When for women who still go on their periods, we say 7 to 10 days after your period, check your breasts, because while you're on period, they're still tender. After that, they are still okay for you to check the whole circumference of the breast. Remember, the breast is not just what we see on the outside. It literally starts on the collarbone, underneath your armpit, up till into your stomach. That's your whole breast. So when you check, you don't just check here, you check all over the whole circumference. Your whole hands must hold there and check your breast on a monthly basis. For women who are not going on periods, we say to them, choose a very right day for you. You know, we always say the payday. On your payday, check your breasts, you know, wake up in the morning and say, today I'm going to hold myself in the shower, check my breast. And that's, if there is something, it will be detected earlier, and that will help a lot. And if you see something like that, you can go to your nearest clinic and they can refer you to Helen Joseph if you're staying afar. If you are in Cape Town, if you are in Durban, you can go to your nearest clinic so that they can be able to assist you. What we do as a foundation, we go around the clinics just to educate people who are there. Even the nurses, sometimes you find that they don't have more information. So that when they check the patients who are asking for help, they would know what to check for.
And you know, Oma, I want to dive straight into all the work that your Breast Health Foundation does. I mean, you have these mobile breast education units around South Africa, but how often do you have these mobile units available in vulnerable communities? And how successful has it been to educate women more on breast health?
It has been very successful. We go around the country, we teach women. It's now that we don't do that because of this pandemic, but we are always everywhere and anywhere. Everybody invite us, the churches, we are at the churches, we are at the clinics, we are everywhere that we are needed.
As a counselor in the field, and of course as a cancer survivor yourself, how important is family and friends support and them also finding counseling for themselves? And on another hand, as a survivor, what advice or words of encouragement do you have for South Africans out there about early detection and seeking the help they need?
You find that the families, they suffer the most and they are on the background. You know, when we talk to the patient, we focus solely on the patient and we don't realize the husband is also suffering, the kids are also suffering. So we make a point that when we talk to the patient, bring your family, let's be together, let's hear how they feel about all of this, because being diagnosed with breast cancer, it feels like it's very, very threatening, life-threatening disease, and it can be managed. So we look into families and say, look, this is how we can help you. We follow the patient up just to say, you are done with the chemo, you are done with the radiation, and now you might go into depression if you're not getting any help into your family. And we support the family to be strong so that they can be strong for the patient. Yeah. That's what we do most, yes.
And any words of encouragement, any final words to South Africans during this month of October?
Know your normal, know your body. Ladies, gentlemen, know your body. If something is wrong, seek help immediately. And the one thing that I can say, keep up the hope. Breast cancer, it's not a death sentence. You can make it. If I had made it, you can make it too.
Yay.
And remember, in life, we survive every day. So don't say, I'm not going to make it. You will survive. You'll make it. You will be called the survivor as well.
Wow. And on that note, from one survivor to the rest of South Africans, thank you so much, Omar, for sharing your story and your words of encouragement. Goodbye.
Thank you. Bye.
Early detection can be a lifesaver. It is important to do regular breast examinations, and if something is worrying you, get it checked out by a professional as soon as you can. Looking after your breast is just as important as looking after your mental and physical health. You can support breast cancer awareness and those affected by donating as little as 10 Rand or become a volunteer. Please check the Afternoon Express social media pages for more information.